Hello, good evening, everybody. Welcome to our live section for our 2022 World Breastfeeding Week. Now, we had a lot of activities within the week. Okay, this is just like a grand finale of what we have been doing for the week. Now, I have a couple of my colleagues here with me, and I'd like to introduce them. I have my able dietitian, Adimchi DK Adile. Welcome to our live section.
Thank you very much. It's good to be here.
Okay, and I also have our able practicing mother dietitian. She's dietitian Peace. She's here with us. Welcome on board.
Thank you. Good evening, Daishan Fechi. Good evening,
Good evening.
everybody.
Welcome. Yeah. So I have two of them, and both of them are professionals, right? Although I like one of them to, come from the angle of a practicing mother. Okay, she has the experience, she has done this thing, she knows it, and she can actually talk about it. She's an experienced mother of two who did exclusive breastfeeding, and also a practicing dietitian, right? And then I have another of my colleague, Adimchi, who is also a professional who is practicing. So I want both of them to come from the angle of a professional and a mother. So it's going to be like a collaboration so that we all get the knowledge that we need to get. So this year's World Breastfeeding Week is quite a unique one because World Alliance for Breastfeeding Action, they came from an angle where they want a synergy between the professionals and the non-professionals who are supposed to be stakeholders, right? Who are supposed to be stakeholders in breastfeeding. So they want everybody to be active. And this year's theme is also quite instructive. It has to do with step up breastfeeding, educate, and support, right? So for us to go into our discussion today, I would like us to look at this theme critically, right? It's quite instructive, like I said. So for you, dietitian Adimchi, who do you think, okay, this instruction is for? This is step up breastfeeding, educate, and support. Who exactly do you think this instruction is for from WABA?
Okay, thank you very much. I believe this year's theme, Step Up for Breastfeeding, Educate and Support, cuts across all stakeholders. When I'm talking about
Okay.
stakeholder, I mean everyone, both professionals, non-professionals, family members, community members, religious leaders, media, government. So the team is talking to everyone. Nobody is left out.
Okay, okay, okay. Dietitian Peace, do you have anything to add to that? Who is this instruction meant for, and why, okay, are they being this instructive?
Okay, we can see that the step up for breastfeeding is actually for everyone. Because if it's not for everyone, they would have streamlined it. Maybe step up for breastfeeding by the media, or maybe made it more specific. Since it's not specific, that means everyone is in this promotion. Everybody is meant to protect and also support breastfeeding. So from the media,
Okay,
to create of encouraging mothers feed, and also a strong way to promote
okay,
it for fathers to be able to support nursing moms in terms of provision of funds, and then helping out with house chores, helping to carry the baby and all that. Then on the part of government, making policies
Yeah.
that will be able to change perceptions and encourage women, maybe creating some insurance plans for nursing mothers and pregnant women. So I think it cuts across everybody, from the nursing
Okay.
mom to the public and to the government.
Okay. Thank you very much. That Shana Dinchi, based on the team we have for this year, okay, I believe that there is there's a stage, okay, at every stage there should be education or support needed for the mothers to do a successful breastfeeding. Okay, I'd like you to give an insight on at what stage do you need education? At what stage does it start? I'd like you to give an insight on that.
Okay, thank you very much. I'll still have to refer to this year's theme, Step Up for Breastfeeding, educate and support.
Yeah, can you
Okay,
hear me?
yes, I can hear you. Can you hear me? I can hear you.
I can hear you.
I don't know why. You can hear me, right?
Yes, I can.
Okay, I think he's having a network
Maybe it's
glitch.
network.
Okay. While we wait for him to come back, I was saying, based on this year's theme, Step Up for Breastfeeding, Educate and Support. Over the years, we've been talking about breastfeeding, exclusive breastfeeding, benefits of breastfeeding, and all that. So, if you ask a lot of people, they will tell you, yes, breastfeeding, breastfeeding. But the question is, why are we not getting it right? Why is it that the targets that WABA, even World Health, have said that by 2025, that at least there will be 50% increase in
Okay.
there will be 50% increase in exclusive breastfeeding rates. Why is it that it seems unattainable at this stage? So, reacting to your question, the truth is there are different stages in a mother's life, and these stages determines the success of breastfeeding. Now, coming from the angle of Step Up for Breastfeeding, WABA have to understand that there are so many
Okay.
stakeholders and active players that have to come together, you know, have an interplay of rules to ensure that these breastfeeding will be achieved. Now, education starts from antenatal stage. Antenatal stage,
Okay.
when the mother is pregnant, go for routine checkup and all that. Now, we should have there should be availability of trained health personnel, trained workers that will always prepare the mind of these mothers. You are pregnant, you will
Right.
soon deliver. Look at how you are supposed to breastfeed. Now, breastfeeding is very important. Look at when breastfeeding is supposed to start and how long it's supposed to last. This is what you are supposed to eat to ensure that you will be nourished and able to take care of your baby. So education starts from antenatal stage. Education
Okay.
even gets to the point of delivery. During labor, there should also be education there to ensure that immediately this woman, even before delivery, she is as comfortable as possible. And immediately there is delivery, to initiate breastfeeding as soon as possible. First of all, let there be skin to skin contact between the mother and the child. Once there is no emergency, as far as everything is being taken care of, then initiate breastfeeding. If you don't have trained personnel or midwives or nurse that will even give that motherly care at the point of
Okay.
delivery, breastfeeding will not be achieved. So, and it still transcend from the time of delivery to postnatal period. Talking about
Okay.
postnatal care, between 6 weeks of child delivery, there should also be education within this period to ensure that this breastfeeding that have commenced, it is being done in the right way. And at all these stages, the health worker have a very big role to play. Now, talking about postnatal stage now, this is also where members of the household, the husband or the father, will also have one or two roles to play. You know,
Okay.
at this stage, the mother can be anxious. My breast is not flowing as it's supposed to be. I don't know if I'm even getting it right and all that. So
Mm.
here, education is also vital. Even to the
Okay.
next stage, after postnatal period, where there is ongoing care, it is very
Mm.
essential. Now, do we have breastfeeding counselors? The mother, the family, do they have access to breastfeeding counselors? Because it have been proven that the uh, the rate of breastfeeding or exclusive breastfeeding may drop, or continuous breastfeeding may drop immediately after postnatal care, as a result of
Okay.
lack of contact. They don't even have access to breastfeeding support group, and so many things
Okay.
might come in. The people, members of the household, are they even supportive? Are they giving words of encouragement? If you notice that the mother is not doing it right, do you even have contact to say, let me refer you to a breastfeeding counselor or a lactating consultant, an expert in all these things? So at every stage, from antenatal, delivery, postnatal,
Okay.
ongoing, and henceforth, education is very important.
Okay. Can you hear me?
Yes, I
Yes, I
can.
can hear.
Okay, go ahead. Are you done?
Yes, yes.
Okay, 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 okay. Sorry, I lost you a bit. I had a glitch there. So, dietitian piece, I like to hear your thoughts on support. Okay, support based on at what stage does a mother require that support, and who is responsible at different stages of this support.
Okay, I would say that the support actually starts even before you take in, because by being educated
Okay.
and maybe seeing people that have given birth and they're breastfeeding or practicing exclusive breastfeeding, it actually motivates or inspires someone to get ready for breastfeeding. Because if you don't make up your mind early, it may not be easy to carry on. So depending on who motivated you or where your motivation is coming from, that's also a form of support. Then when you get pregnant and you start your antenatal classes,
If you can hear
the
me, I
physicians
would like
educate.
us to wait a bit for them. I guess there's a glitch in network. They will be right
Okay.
back here with us. Okay, you're back.
We can hear you.
Can hear you now.
We can hear you loud and clear.
Okay, I said during antenatal classes,
Okay.
the nurses, the doctors, here in Nigeria, I don't know if we have lactation consultants, but I know in abroad there are so many of them. They give talks,
Yes.
even the dietitians and the nutritionists, they have sections in antenatal where they educate
Okay.
the expectant moms on how to go about taking care of their breast, breastfeeding, positioning and attachment. So all these are all forms of support. So if the nurses, if the dietitians, the doctors, the lactation consultants, the physiotherapists, everybody plays its role you will see that the outcome, the 50% outcome we are looking at by 2050 will be something that will be achievable. Because believe me, there are still misconceptions, there are still perceptions concerning breastfeeding, even amongst learned mothers. The few posts I've made, I've seen reactions on that. And that means there are some behaviors that actually have to change. And it can only change when there is knowledge. Then they accept the knowledge and then it just towards attitude and it becomes a behavior. If these support systems are not there, it will not actually be enough to encourage them to breastfeed or even practice exclusive breastfeeding.
Mm.
Then after the antenatal phase, the postpartum delivery phase, the nurses will be there to ensure that the baby gets attached within 30 minutes to 1 hour of delivery. Even if it was a cesarean section, as long as the mother is stable and the child is
Yeah.
fine. As my colleague Bashana Dinchi has said, do the kangaroo method, body to body attachment, because that's even when the stimuli and everything starts connecting. Put the baby
Okay.
to the breast, to the nipple, and then to the areola. Make sure the mouth touches the areola of the breast.
Mm.
This will trigger neurotransmitters and so many things to ensure that there is letdown. Even if whatever quantity that is coming is small, just ensure that the baby is just attached there with time, because it's the more they demand, the more they supply. If the baby does not put the mouth there, nothing is going to come out, and even if it comes out, it may be low supply and it may
Yeah.
discourage the mother. So the very
Yeah.
first attachment is very, very important, because it will also
Okay.
help with the suckling reflex of the baby. Most babies
Okay.
have very strong suckling reflex and grip. So if those things are not there, it may be difficult for the baby to suckle
Okay.
more. Very vital.
Okay. Okay. Thank you very much. From what you
Then
guys have
by the
said,
time the nursing mom, okay,
go ahead.
by the
Go
time the
ahead. Go
nursing
ahead.
mom gets home, by the time the nursing mom gets home, as my colleague has said, the father, the mom of either the lady of the nursing mom or the baby will be there to help.
Mm.
It's not easy because, like, for most first time moms, I know the vagina and the clitoris and all that. There may be so much
Mm.
pain for the mom. So if postpartum depression sets in, the rate of milk production may be quite low and it may be slow as well. So if
Mm.
this person has a support, maybe when you want to eat, the food is available, someone has already helped you to eat, there is money available to afford what you will eat. Then someone is
Yeah.
helping you with bathing the baby or even helping you to shower. You see that there will be a whole lot of support and you'll be motivated to at least concentrate on the breastfeeding, because the breastfeeding itself is also an activity. So all these
Yeah.
phases all needs
Yeah.
support system.
Yeah.
The nursing mom actually needs to be helped. Then the government too, if they fail to help the nursing mom, as Daishana Timchi has said, most
Are you
people
there?
do
Can you
not
hear
even
me?
have access to, yes, most people do not have access to quality health care or even primary care center where the
Okay.
fee or the bill is
Okay.
affordable. So
From all you've said, I've I've been able to deduce a couple of things.
I hear you.
I think his
Sorry,
network
I
is a
think we are
little bit
having a
slow.
serious glitch in network. Sorry about that.
Yes, it's raining
Sorry
here,
about
so I
that.
don't know if my own network is bad. So
Education starts from before the woman or hello, can you hear me?
Yes, we
I
can
can
hear
hear
you.
you now.
Hello, can you hear me?
Yeah.
Yes, we can.
So I'm saying that from what you've said, education and support starts from right, and then cuts across delivery, sorry, antenatal, breastfeeding proper. Okay, and if at every stage the professionals or the stakeholders at that stage don't play their role, it's going to affect the outcome, because naturally
I think his network is really fluctuating.
can you hear me?
Yes, I can hear you. I think your signal was really fluctuating.
The network glitches a lot and it's not raining here. So I was saying that what you guys were saying in conclusion was that both the education and the support starts from before, the pregnancy, and at every stage, and it cuts across um, during childbirth or during antenatal, childbirth,
Yeah.
postpartum, ongoing breastfeeding, right? And
Yes.
because some mothers are looking for reasons, not to breastfeed. So this should not be, cut off, okay? At every stage, everyone that is involved in providing the necessary support should always provide such support, in order not to give them reasons not to be, um, not to leave exclusive breastfeeding. Okay, so I like us to look at it from another perspective. Okay, you, Adimchi, I'd like you to give us an insight to some of the challenges you've noticed as a professional in the field that is a kind of a militating factor to some mothers doing exclusive breastfeeding, right? I'd like you to give us some kind of problems that you've noticed, okay, at different stages, as we've said. What are some of those challenges that mothers, have as their reasons for not, doing exclusive breastfeeding, and who are those responsible, at that stage?
Okay. Thank you very much. Uh, the truth is, I'm so glad that Waba came up with this team and for us to look at a different perspective of promoting, protecting, and supporting breastfeeding. Okay, professionally, I've realized, and with the cases that I've been able to take care of, I've realized that the healthcare professionals, the healthcare providers, have these parallel system of management in the sense that there is lack of synergy. Okay,
Okay.
and these in turn have actually affected a lot of cases that could have easily been taken care of. Now, with respect to antenatal, okay,
Yeah.
I've seen cases where women are you there? Can you hear me?
Yeah, I can hear you. Go ahead. I can hear you.
Can you hear me?
Yeah, I can hear you. Go ahead.
Okay. From antenatal stage, there's this issue, people hardly come to hospital. Okay. People hardly come to hospital for regular checkup and all that. What they
Okay.
usually do is stay at home, book an appointment with a traditional midwife. So that's
Okay.
what they normally do. And the need for coming for antenatal, the obstetrician or the gynecologist will be able to routinely evaluate you and know if there will be complication, if you can actually deliver through vaginal delivery, or if
Normal.
there will be need for CS and all that. And at every stage of your antenatal, visit,
Okay.
the health workers
Yeah.
are supposed to be there to
Yeah.
re-emphasize on the need for proper preparation and
Okay.
education on breastfeeding. So
Okay.
I've seen cases, I've managed cases where mothers presented with a case of malnutrition.
Mm.
And when I take history, I ask them questions like, did you do antenatal care? Did you do antenatal during your pregnancy and all that? They will tell you the truth is we don't even know what antenatal is all about, and we didn't do it. So now I will blame it on uh, both the health workers, the media, and government. For instance, some will tell you I'm staying at a very far distance from the hospital. I live in a rural setting. We don't have
Mm.
standard hospital. We just have primary health centers there. And the truth
Mm.
is, this message can be taken home even to the grassroots, even at the primary health centers. Just
Mm.
like when I was working as an Empower volunteer at a primary health center in Abia State. I was there. I ensured that as women are coming for visits, I ring it as a bell on the need for preparation, adequate preparation before delivery, after delivery, the need for adequate preparation. So one of the major challenges, they hardly come for antenatal visits. So
Okay.
especially those in the rural area, and they don't even know that at the primary health center such services could be
I
there
give
for
it.
them. Now,
Mm.
I will also say the government is not doing enough to let people know that we render this type of services. Okay, then within last week, I was opportune to be in the team that was managing a woman that just gave birth. So the first thing
Okay.
I did while we were on rounds observing the woman, I asked her, have you started breastfeeding? Because she just delivered yesterday and we went to see her the following
The
day.
next day.
Have you started
Mm.
breastfeeding? Yes, I've started breastfeeding. How is the flow of your breast milk? She says it's
Mm.
just coming. Did anybody tell you what to do concerning breastfeeding? Even
Mm.
the relative, the sister that was there, they were just there.
Mm.
Lack of information. So I'll still bring it down to uh, lack of maternal friendly centers, lack of uh, baby, what do we call it? Baby friendly hospital
Okay.
Baby friendly.
initiative.
Okay.
Yeah.
Okay.
So when all these things are in place, some of these
Yeah.
problem and challenges of not knowing what to do, how to breastfeed, and getting the right information will be taken
Mm.
care of. Now, what about postpartum care, postnatal care? Sorry,
Mm.
I've seen patients, they've already taken the decision. I'm not going to breastfeed, and when you ask them why, say they lack support. I'm also part of the breadwinner, and if I give my whole time breastfeeding, we will go hungry. The rest of my children will go hungry. So
Yeah.
these are challenges that I've seen. Now I've
Okay.
asked some fathers that have actually come to my office. Do you know that you are supposed to support your woman? Do you know that you are supposed to help to ensure that there is proper breastfeeding. They'll be like,
Yeah.
am I the one with the breast? Am I, my own is just go and get the food and get the money for the food, come back. Am I the one with the breast? So they are not informed. The other
Okay.
time I visited the antenatal and children outpatient clinic, and I saw some fathers there. I really encouraged them. I was so elated. I said, at least coming around, hearing what the health care personnel have to say will
Mm,
motivate you and also give you the reasons why you have to support. So these are
mm.
challenges that I've actually seen. One, as a
Okay.
result
Okay.
of lack of information, and two, health personnel not working hand in hand, and three, some of us or some of the health personnel are not
Okay.
well trained, are not well informed on what
Informed.
to do
Okay.
in
Okay.
order to ensure proper breastfeeding.
Okay.
So
Okay.
these are
Thank you very
challenges
much.
that I've actually seen on the job.
All right. Thank you very much. I think this was quite extensive. Um, Dietitian, please, do you have something to say with regards to what he just said, or from the angle of mothers, right? I know that they have their own challenges and it's quite enormous. So I'd like you to highlight some of them and who are those responsible at different stages to provide, those kind of, or to solve those challenges that mothers face.
Okay. Pardon me for the dark background. There is no light here and it's raining heavily.
Yeah, no
I've tried
problem.
to make adjustment, but the room is still dark. Okay, from the angle of a mother who has practiced exclusive breastfeeding twice, some discouraging, or will I say, things that could be barriers can be from the woman's body or perspective. I'll just
Okay.
highlight a few.
Okay.
Oftentimes, women have breast engorgement.
Okay.
When there's breast engorgement, the breast will be too full, it will be heavy, and it will be painful.
Okay.
So if there is no support or there is no help, and the woman passes through that phase of pain alone, the woman may be discouraged because it will be difficult for you to feed the baby. And then you're also having lots of pain
Okay.
because of the engorged breast. It could be that you went to work and stayed at work and the milk kept getting full and there was no way it was expressed. That's
Mm-hmm.
why we're advocating for at least 6 months of maternal leave now. So that the
Mm.
critical phase, mothers will have time to breastfeed on demand. Because when your breast is too full and there's no expression and there's no baby suckling it, engorgement could
Mm.
occur. There could
Okay.
also be blocked duct. The
Okay.
breast has dots. These dots run down from almost the chest to close to the nipple. That's what conveys the breast milk until it enters the baby's mouth. If the
Okay.
baby does not suckle or there is inappropriate drainage, these dots can
Mm.
also be clogged.
Mm.
Once this occurs, it could lead to an infection, it could lead to pain, it could lead to other things that may discourage the mother. Because at that phase, it's not just about feeding the baby, you're already having some internal pains or some things to deal with.
Okay. Okay.
So all these
Okay.
are things that are barriers that have to be looked into.
Okay. 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 Thank you
So
very much.
as my
I
colleague
really.
has said, the education starts. Yeah, if
Okay.
the mother is not well educated on how to prevent breast engorgement, not getting the
Mm-hmm.
ducts clogged and maybe having an infection later on, it could
Yeah.
affect the woman so badly that she will be discouraged and give up on exclusive totally. And before you know it, she will say, okay, I'm done breastfeeding. One
Yeah.
time, maybe
Yeah.
at 3 months, she said, I don't try and I've tried. So once she has made that decision, it may be final for her. And then another
Okay. Okay.
challenge could be returning to work.
Yeah.
Some of them
Yeah.
could go back to work. So because of that, they have to discontinue.
Mm.
So there
I.
are so many factors. Some could be
Yeah.
lack of food in the house because you have to eat well
Yeah.
to exclusively breastfeed.
Yeah.
so that it won't be
Yeah.
easy and you'll be able to provide enough milk to feed the baby. So if there is lack
Yeah.
of money, if there is lack of capital and no food, is fact is the number one barrier to stopping exclusive breastfeeding.
Yeah, yeah, that's quite exhilarating. I really appreciate you for going through, each of those, factors that militate mothers, because you are a mother and you understand the pains of mothers. That was why I wanted you to come from the angle of mothers to, enlist some of those challenges. Now, for us to we are getting towards conclusion, but I would like us to, within the week, okay, we went out and there were a lot of videos that, they we had, all right. And some of the things that the young men said were the reasons for not going to support their wife was still this very reason, right? That once they breastfeed, that their wife's breast will sag, and this has been an ongoing belief, for many men, especially many of them that don't know what happens from pregnancy, so they make this assumption that they will not support. In fact, some of them said from the first day it's going to be infant formula. I know some will say just do 3 months and leave your breast for me, So some of them come up with some of these excuses, which their wife, is discouraged and, have to yield to. So what do you have to say to them, Madimchi? I'd like you to speak on that.
Okay, thank you very much. Now, within the week, I actually asked questions to men. One of the questions I asked them is, will you allow your wife to do exclusive breastfeeding, you know, with respect to the benefit of exclusive breastfeeding? If you hear that the breast of your wife will go down or sag, and you need to say some funny responses, and so we are like, no, I will not permit that. I will not agree. For what? They will just breastfeed small. They will not. I will not permit my wife to breastfeed for 6 months. All that. And there's
Yeah.
this particular person that told me that he will permit that since it's for the benefit of their child.
The baby.
So I was like, are you sure? He said, even if he will still benefit from the breast, that he will ensure that is strictly for the child. So I went ahead to encourage him that the truth about breast is at the right age, at a certain stage in life, the breast will sag. The muscles will lose its elasticity and all that. It will definitely sag. So even if you chose not to breastfeed, at a certain stage, the breast will sag.
Mm-hmm.
Unless you decide to do liposuction, unless you want to say young forever, go through some medical procedures, plastic surgery and all that. But naturally, whether you breastfeed or you don't breastfeed, the breast at a certain stage in a woman's life will sag. So why would you now deny the baby of this golden opportunity? You know, breast milk is really vital, and if it is
Mm,
done in a right way, exclusive
mm,
breastfeeding and continuous breastfeeding after 6 months, the truth is the testimonies, the benefits are tremendous.
yeah.
They are tremendous. Nothing, it is second to none. So fathers, mothers shouldn't be discouraged about breast sagging. They should
Okay.
breastfeed their baby at the right time.
Yeah. Thank you very, very much. Peace. I don't know if you have something to say about that. I know that as a woman, you must have come across those kind of people. Even some ladies too, they are part of it. They say they don't want.
Of course.
Okay, I think she has a glitch. So while we wait for her to come back, Adimchi,
Okay.
I'd like you to give some kind of advice, to young ladies who also have this notion, um, or who are looking for reasons not to breastfeed, right? There are some ladies
Sorry,
who,
I didn't get you.
can you hear me?
Yes, I can hear you now.
Yes, I want you to give some advice to ladies who are still indecisive about this. Some people I know that they are still confused about what to do or what not to do, right? So they are in that state where they are still thinking, I don't know if I'll do this. I don't think I'm prepared for it, So they need more reasons to, see to it that they ensure that this is done. So, what do you have to say to this kind of people? As they are young people, they are not yet married. What do you have to say to them?
Okay. I will start by saying the greatest gift a woman can give to a child is breastfeeding. That's the greatest gift. So for intending mothers or potential mothers, you don't need to be discouraged. You don't need to be confused about that. And at different stage in life, what makes our project or any step we want to take easier is to look out for mentors.
Mm,
So it's not something you have to decide on your own. I don't want to do it. I'm encouraging them to seek for help, seek for professional guide as far as breastfeeding is concerned. In fact, the benefits are too numerous to mention. So when we look at something that is very beneficial both to the baby and to the mother as well, even to the environment, community, and family, why will you be discouraged? In as much as it could be challenging, you shouldn't be discouraged. So I will advise them first determine, prepare in your mind whether you are married or you are about to get married. Be determined that I have to be among those that will give this best, greatest gift to my unborn child. That's number one. And no matter the challenge, I'm willing to overcome this challenge. I'm willing to seek professional help. So this is my advice for them. Uh,
okay.
they shouldn't just on their own decide I will not do it before they take such decision. In fact, they shouldn't decide because
Hmm.
breastfeeding is the right of every child. So I'm
Okay.
encouraging them to
Thank
forget
you.
about every fear, every concern, and
Yeah.
make up their mind to breastfeed.
Okay. Okay. Thank you very much. I had this friend who is a African American. So when I was talking to her about this program, right, or the World Breastfeeding Week, what she told me was that in America, breastfeeding is for poor people. You know, it's not something they value there. So once you give birth to your child, you initiate infant formula. They don't talk about breastfeeding there. So it's not something that they promote. So I try to find out why. And this is a mindset, okay? Even those of them who actually have time to do it, they don't want to do it because there's an acceptable norm in the society there that people that do it are poor. It's for the poor. Once you're breastfeeding, you are poor. So most people tend to, go, infant formula way, right? So it's a major issue in their own culture. But here, I know that we have a problem of heavy ignorance in the aspect of poverty, in the aspect of not having enough to eat, a lot of discouragement. But over there, their own is that
Social
they have,
cultural factors.
yes, social cultural factor. But over there, they have all these things. They know the knowledge is there, but it's not acceptable. I can liken it to I can liken it to diabetes, right? We have two types. One is that there is no insulin. So here there's no knowledge here. Then the other one is that insulin is not sensitive.
Yeah,
So over there they have the knowledge, but they are not sensitive to it.
exactly.
So it's a crazy
Exactly.
thing, actually. So please, I'd
They
like you to
feel that
do,
they have substitutes.
yes,
I said they feel that they have substitutes and they have a lot of formulas and they eat well.
ex-
So most
exactly,
times that
exactly.
what would even make them to breastfeed. So they feel
Mm.
they have better options
Exactly,
and they
exactly.
don't want too
And
much bonding. They don't want the child to be following them all around the house. Like just be on your
yeah,
own, let me be on my own because breastfeeding keeps the attachment so strong. So
yes. And they
everybody
don't
has
like
to
it.
just be on their
They
own.
don't like it. They don't like that attachment. That attachment is a very bad, because I
Yes, they
have
don't.
discussed with her at length. So she usually tells me there's a baby in the house with her. So she usually tells me, no, I'm not with her. I'll talk to her, I'll find her later. So throughout the day, she can actually not see that baby. That baby is 3 years, but they are not that connected that much. So they don't, that
And
connection is not.
and
So
still
so that's what
and
I
this
I
still
understand.
discovered.
this
And it's like a culture. It's not a crime for them. It's not like it's a normal culture. And these are cultural differences. Over
That's why
here, you don't.
that's why we have to increase awareness and protect breastfeeding. Because
Exactly,
for
exactly.
children less than 6 months, if all things being equal, they're not meant to take substitutes, they're not meant to take infant formulas. So advertising any infant formula for a baby of less than 6 months is inappropriate. So let's protect breastfeeding and see
Yeah,
that people can accept it. We are first mammals before every other thing. Our reasons for being
yeah,
mammals is because of the breast milk. It's not just the beauty.
mm,
So if we are mammals
yeah.
because we make milk, we should be able to feed the baby because that's the basic fundamental right for being a mama and being a human being. That's just my own perceptions anyway.
Okay. Please, I'd like you to do a concluding part of this, by speaking about that, the breast sagging and all the, issues around it, just in a conclusive way, so that we come to an end of this live section.
Okay, like what my colleague has said, Dashana Adichie, today, tomorrow, in the future, the breast will still sag. We're under the law of gravity. Whatever goes up will come down.
Yeah.
And we should all remember that we are mammals. That means every woman has the right or the opportunity to breastfeed.
Mm,
So if
okay.
you have a baby or you want to be a surrogate mom and you know that you can breastfeed, just have the notion that you are feeding a baby, you are providing a food for the baby. So leave out the breast. The breastfeeding does not serve the breast per se. What actually serves the breast, as we've looked before, is just the metabolic activity surrounding you are either gaining weight or you are losing weight. When you
Yeah.
gain weight, you gain adipose tissues as well in the breast. And during pregnancy,
Mm,
we see that you have to gain weight so that you form shock absorbers and also part of the
mm,
maternal body that you will definitely
mm,
add weight. So when you add weight, some fat will also increase in the breast. So as long as you are breastfeeding, some of these fat mass tend to dry up or go back to their normal state because the phase of pregnancy has actually
Mm.
gone and you're already not seeing a baby. So the increase in the cell, the fat cells, and the decrease is what actually triggers this, and not just the breastfeeding.
Mm. Okay.
It's just the
Okay. Okay.
metabolic activity surrounding weight gain and weight loss,
Yeah.
and then gravity on its own.
Yeah.
So, I just for me, I encourage every mom to try to breastfeed because the
Okay.
benefits are numerous. Like number one for me is just the immunity. You're already giving your baby the first vaccine. So even if they
Exactly.
have malaria, it won't bring them so down that you start running helter skelter.
Yeah.
You just see the
I
strength in them. So if you have
I
the
remember.
time, if you have the opportunity, and you have your support system, don't just
Yeah.
think about sagging breast or something. Just try and breastfeed your baby.
Oh, wow. Thank you so, so much. I remember one of the people we interviewed within the week, the man, alluded to that fact that he has 5 children, right? The second one was given exclusive breastfeeding, and the difference is clear that other ones can be sick, they get sick almost every time, but that particular one is distinctively healthy, that they don't have issues, they don't complain about sickness. It's just
I'm
little
a living
malaria, before
witness.
you know
That's
it.
why I'm promoting it because the
Yes, yes, yeah,
breast
because
milk
even if
is just a vaccine and immunity because it has a lot of antibodies. So it
mm,
forms, we like to, an innate protection for this baby before every other thing.
exactly,
Exactly.
exactly. So it helps them to save money that they will use in buying medication when the baby gets sick, uh, later in life. So whether you're saving money, not to give your wife food that she will be ready to breastfeed, I think the best investment is for you to save that money by giving her the money to feed well so that she'll be able to breastfeed, and save you the money
Yes,
that you will spend
right.
ahead of time, because you will still buy medication, you will still go to the hospital, you will spend all those money taking care of the baby when the baby is down. On that
You pay
note,
for bed
I want to
space.
yes, yes, yes. On that note, I want to really appreciate both of you. Okay, thank you so much. If you have a final word, you can give it now so that we call it a day on this.
Yeah.
So we have a comment on our Facebook
Okay, I would
page.
say that
Go
We have
ahead,
a comment.
Aditi.
Someone said breastfeeding is not for poor people, as some may have told the moderator. It depends on how much education on breastfeeding lactating women have had in a particular circumstance. It is
Mm.
encouraged for both the rich and the poor women here in USA.
Okay, okay,
So
okay, okay.
the person is saying, the person I think is reacting to what
What I
you
said earlier.
actually said.
Okay,
Yes,
okay,
that breastfeeding
okay,
is not for poor people. As
okay.
okay,
someone might have told you,
okay,
that
okay, okay.
both the rich and
Thank,
the poor are
thank you.
encouraged over there to breastfeed.
Okay, okay. Thank you very, very much. I really want to appreciate both of you for making out time to, do this with me. And I would like to say happy World Breastfeeding Week 2022 once again. And thank you very much for showing up. I wish you all the best. So we call it a day today. I'll see you on the other side. Bye for now.
Right. Thank you.